Welcome to our educational video on cellular adaptations. Whenever there is change in environmental conditions, there is stress on the cells. For the sake of survival on exposure to stress, the cells make adjustments like physiologic and pathologic adaptation. If the stress continues, the cells get injured, which can be reversible until point from which the injury is irreversible. These adaptations are reversible upon removal of stress. These adaptations occur through specific processes. Let's learn each type. The first adaptation is atrophy. It is the reduction of number and size of parenchymal cells. Atrophy can result from physiological or pathological causes. These are the examples of physiologic atrophy. Pathological atrophy includes starvation atrophy seen in cancer patients. Ischemic atrophy occurs when atherosclerosis reduces blood supply, causing organ shrinkage. Diffuse atrophy occurs with prolonged diminished organ activity. Others include neuropathic atrophy, endocrine atrophy, pressure atrophy, and idiopathic atrophy. Hypertrophy. It is increase in the size of parenchymal cells resulting in enlargement of the organ or tissue without any change in the number of cells. It can result from physiological or pathological causes. The enlarged size of the uterus in pregnancy is the best example of both physiologic hypertrophy and hyperplasia. Pathological hypertrophy includes hypertrophy of cardiac muscle, smooth muscle, skeletal muscle, and compensatory hypertrophy. Hyperplasia. It is increase in the number of parenchymal cells resulting in enlargement of the organ or tissue. The cause of hyperplasia is increased recruitment of cells from the resting phase to undergo mitosis, stimulated by various factors. Labile and stable cells can undergo hyperplasia while permanent cells cannot. It can result from physiological or pathological causes. Physiologic hyperplasia or abnormal cell growth can be hormonal or compensatory. These are some examples of hormonal and compensatory hyperplasia. And these are some examples of pathologic hyperplasia. Metaplasia is a reversible change of one type of epithelial or mesenchymal adult mature cells to another type, often triggered by abnormal stimuli that can lead to cancer if the stimulus persists. It is categorized into epithelial and mesenchymal types. These are some examples of squamous and columnar metaplasia of epithelial type. The mesenchymal metaplasia involves the transformation of one adult tissue type to another. It includes osseous and cartilaginous metaplasia. Dysplasia or atypical hyperplasia is disordered cellular development, often occurs in epithelial cells characterized by proliferation and cytologic change. These changes include increased number of layers of epithelial cells, disorderly arrangement of cells, loss of basal polarity, cellular and nuclear polymorphism, increased nucleocytoplasmic ratio, nuclear hyperchromatism, and increased mitotic activity. If you found this video helpful, please like, share, and subscribe.